Hey everybody, welcome. I'm Dr. Perkins. This is my channel. I'm a board certified OBGYN and I love talking with you guys about things that you can do to improve your body. And with that, today we're talking about which month to start exercise during pregnancy. By the end of this video, you'll learn about some of the common misconceptions that you've heard possibly during pregnancy. We'll talk about what ACOG recommends as far as exercising during pregnancy. We'll review first trimester, second trimester, and third trimester exercise. And we'll talk about tips that I'll give you regarding exercising during pregnancy. So let's jump on in here. Now, as you go through pregnancy, sometimes you have 1,000 questions about what to do, what not to do, how to do it, what's safe, because abnormal things happening like miscarriages and stillbirths and all the scary things that can happen. And so I'm glad that you're thinking about this because it is truly an important topic and it's something that you can physically do to help your pregnancy and help your body as well. And so it is actually recommended that you exercise throughout your pregnancy. Oftentimes, I look at this from two different ways. The first is that you may be someone who doesn't exercise at all. And you're just like, well, I don't exercise. I have a new pregnancy. I want to ensure that this pregnancy is the best. And so if that's the case, you may be wondering, well, can I start now? And my answer is yes, you can. If you are on the other side of things where you're just like, I normally exercise, I am an athlete, I do this regularly, and I want to know if I can continue with this, this video is for you as well. Because regardless of which side you fall on, exercising during pregnancy is safe. It is okay. It is actually encouraged. It's encouraged because you'll help your body, but you'll help to have a positive pregnancy outcome. And so it is important that we do this. I do have some recommendations though, depending on where you're starting out from. But before we dive into that, there are so many misconceptions when it comes to exercising during pregnancy. I've definitely heard that, I might lose my pregnancy if I exercise, which is not the case. I have heard that you should not exercise as much, or you shouldn't start exercising during pregnancy if you haven't been. And that is not the case as well. I want you to have a conversation with your doctor and know if you're having a normal pregnancy or a pregnancy that is high risk. If you have a high risk concern, then I want you to follow the recommendations of your doctor. There are times when we might say it is unsafe or not encouraged for you to exercise during a certain part of your pregnancy. And so this is why a conversation with your doctor is important, because there are times when specifically we may make these recommendations for you. If you're having a completely normal pregnancy, it is completely normal and encouraged for you to exercise on a regular basis. And this is throughout your entire pregnancy course. First trimester, second trimester, and third trimester. ACOG, which is the organization that makes the recommendations and guidance for providers when it comes to pregnancy, they recommend 150 minutes of moderate intensity exercise throughout pregnancy. And this is not specific to a trimester. So they recommend it, and so I recommend it as well. The difference here is that as you go through the different trimesters, you may experience things that may impact your desire and ability to exercise. Again, if you're having a normal pregnancy and you are wondering about exercising, it might be harder in your first trimester. The reason is a normal pregnancy may have extreme fatigue in the first trimester. You may have a lot of nausea and vomiting during your first trimester. You may have weight loss because of these changes during your first trimester as well. This makes it hard for you to find the energy to physically do exercise or purposeful exercise. And so that is physiologically understandable. And so if you were exercising before pregnancy and you find that first trimester you're having a hard time, it is okay for you to fall back, for you to slow down, or for you to even stop exercising as you have these difficult moments, because they're short-lived. And usually going into your second trimester, you'll find that things are feeling much better than they did in your first. And so if you were exercising before, slow down if you need to, listen to your body. If you weren't exercising before and you're like, it's not that bad, I feel pretty good and I like to start exercising, you can absolutely start in your first trimester. I'll also mention before we continue on here that if you're new to exercising, you may want to use a trainer in your first trimester if you'd like to start out with purposeful exercise. The reason is I want to decrease, or I would encourage that we reduce the risk to injury that can happen for anyone when you start a new exercise regimen. And so when you have someone guiding you and someone who's well aware of pregnancy and the changes of pregnancy, they'll be able to guide you as far as which exercises to do in the first trimester when you're starting out. Now let's move on to the second trimester. The second trimester is a wonderful place of pregnancy for most people. The reason is all the hormonal chaos and changes that happen in the first trimester has essentially now settled. And so the fatigue has been lifted, your energy is back, your diet and your appetite is like back to normal. Most people find the second trimester to be a wonderful place to be. And this is between 14 weeks of pregnancy and 28 weeks of pregnancy. Most people are cruising at this time. And at this time, you may be able to exercise regularly, and if anything, you can even increase your exercise intensity because you feel pretty normal. It's a beautiful place to be. Use this energy and you can start exercising then or continue on with what you've been doing throughout the first trimester as well. In the third trimester, we're talking the last 12 weeks of pregnancy. There are a lot of changes that are occurring in your body that I want you to be mindful of. Can you exercise? Yes. Do we encourage that you exercise? Yes. Exercising will help with how you feel. It will help with labor and how you are transitioned to delivery, maybe. It will help with the weight changes that may happen in the third trimester. It is a great time for you to exercise. The end of pregnancy or the third trimester, often though, you feel quite pregnant, and most people are counting down until their delivery because they are well over it. They're ready for this to be done. And so this is because your baby and your pregnancy at this time is really transforming so quickly. They're gaining weight very rapidly. You're feeling the changes very rapidly. You're now having issues with your bladder and with swelling of the feet. You are feeling miserable maybe. Maybe you're having a great time. And so all these rapid changes are happening and you're feeling the changes. And because of that, that can sometimes take away from your energy and your mobility as well. You may not feel like you can squat as low or you can run as fast. These changes are real. And so I also want you to be aware of hormonal changes that happens in your third trimester. There is a hormone called Relaxin. It is a wonderful hormone. It is released throughout your pregnancy, but really truly in higher amounts in your third trimester. And so as the name may, hint to you, relaxin means to relax. And so you might say, well, I want to relax. Give me more of this. But it doesn't quite work that way in your body. Relaxin actually causes your muscles and your joints and the connections between them to loosen and relax a bit. The reason is this hormone is important for helping a baby pass through your pelvis at the point of delivery. And so your third trimester starts with your body pumping and releasing relaxin into the system, allowing your joints to relax a bit. The problem with relaxin is that it is not able to target your pelvic bones only. If it could, that would be wonderful. We wouldn't be having this conversation, but it doesn't. Relaxin actually allows every joint and muscle and tendon in your body to relax a bit and to separate and to loosen. And so, while this is great for a baby passing through your pelvis, it is not great for the other parts of your bodies that we want to be strong and stable. And so, in your third trimester, when this hormone is being pumped into your system, you may be at increased risk of having joint dislocation, joint separation, muscles being pulled and sprained. We can have complications greatly in the third trimester because your body is naturally preparing for birth, but it also affects every other part of your body. So I say that to say, I often do not recommend starting an exercise regimen newly in the third trimester. If you haven't been doing it and haven't been training your body, starting in the third trimester can come with increased risk of injury. Now, if you're working with a trainer and they understand the processes of pregnancy quite well, they may help to reduce this, but your third trimester is a time when starting can be problematic. Now, if you've been exercising and your body is used to doing this and you've created a body composition that is ready and structurally used to exercising, I want you to continue. I recommend that you continue. ACOG recommends that you continue. You may feel as though you need to bring it down a notch though. And so if you were lifting 100 pounds, you may be more comfortable lifting 70 pounds now. Now mentally, I know that sometimes you may struggle and say, well, I could do more, or I used to do more. That's normal, but understand that you're undergoing a temporary state of changes internally that actually makes you feel a little bit weaker, or you may feel as though you can't handle as much because you are growing a human being. And so it is temporary. If you're already in your third trimester, you are close to being at the end. You're close to meeting your new baby. And so we want you to cruise in your third trimester. Either continue what you've been doing, lower the intensity of the exercise you've been doing just a smidge, or wait until your postpartum period has cleared, the first 6 weeks that is, or 8 if you had a C-section. Wait until you've cleared that period with your doctors and then start a new workout regimen. I'm excited that you are thinking about exercise, you're trying to exercise, because exercise truly will reduce pregnancy complications like preterm birth, preterm delivery, having gestational diabetes, hypertension or preeclampsia. Even hemorrhaging can be linked with a lack of exercise. We know that exercising will also increase the likelihood of you having a faster and better vaginal birth. Exercise links with all of these things, and starting as soon as you can or even before pregnancy will help even more. I hope this all has been helpful for you. Let me know in the comments what you have done. Have you exercised throughout your pregnancy? Did you have difficulty? Let us know in the comments. Now, if you are working on getting your hormones together and exercising well and you want a little bit of guidance with this, I'd love to send you a free copy of my ebook, Hormones Don't Lie. With that, we talk about hormones, we talk about physically exercising, we talk about how your body changes because of this, and I'd love to send you a copy of this. Click the link below this video and I will send that link right over to you. Thank you for joining me today. I'm Dr. Perkins, and again, I hope you enjoyed being here, and I'd love to see you next time.